We're in Colorectal Awareness Month, trying to let people know the importance of being vigilant about their health. Joining us now is Kristy Thurston, colorectal surgeon at Hartford Hospital. Doctor, welcome.
Thanks for having me.
Thank you for being here. So tell us, how common is colorectal cancer?
Colorectal cancer is the second leading cause of cancer deaths in the United States, and every year approximately 140,000 people are diagnosed with it.
That is amazing. I had no idea. All right, there are new recommendations for screenings for colon cancer. Tell us about those.
Sure. So some organizations, including the American Society of Colon and Rectal Surgeons, has lowered the recommended screening age to 45 from what was prior 50. So that is definitely a message we want to get out there and remind people to come on in for their colonoscopy if they haven't yet.
And it sounds like you're seeing more younger people dealing with this.
Yeah, that's been a trend that's been closely followed and certainly led to the change in these recommendations.
Wow. All right, what would you say to people who are worried about having a colonoscopy?
It is never as bad as people are anticipating.
I agree.
The prep is always feared. It's not as bad. And the procedure itself takes about 20 minutes. You're safely under anesthesia and home later that same morning. So worth doing.
Even during COVID, they've kept it so safe, and people are continuing. All right, Hartford Healthcare is hosting a webinar about colon cancer. Let's talk about the details as we look at a full-screen graphic.
Sure. So the Hartford Healthcare Digestive Health Center is hosting a free webinar about colon cancer on March 25th. Topics are going to include an in-depth look at signs and symptoms of the disease, treatment options, as well as a live question and answer session with the experts. We'd love to have you join us, and we hope to be able to answer all of your questions then.
I love the way you've gone on with your education on these webinars. Does it strike men or women more?
As far as colon cancer, it is a little bit more common in men, but we certainly encourage our female patients to come on in and get screened as well.
All right. And how far out are you screening at this point? Do you have any idea?
As far as when we, the age limit for folks,
yes,
for when we stop screening, anywhere from, so 75 was a common age to stop screening. However, we're seeing more patients that are healthy into their 70s and 80s. So it really is on a patient by patient basis. And if it's appropriate to screen someone in their 80s or to follow up on a symptom that someone may be having, it's absolutely a doable test.
All right, Dr. Kristy Thurston, thank you so much for joining us. A lot of great information.
Thank you.
Thank you.